Greetings, my name is Michael McKibben. I'm a chiropractor. I want to talk about whiplash injuries causing spinal misalignment. This chart is over 50 years old. The idea of the mechanics of whiplash, cervical misalignments, was well in place among chiropractors when I was a student. And the concept is a person's parked at the stoplight, they're rear-ended, their 10 to 12 pound skull whips back and forward uncontrollably several times. And if you look at the second line down, the structure of the neck bones, and I think quite a lot of the other rest of the spine, can be adversely changed with that motion back and forward and then permanently structurally misaligned. That's referred to as the mechanics of disc derangement and resultant pinched nerve. Many patients have come in over the last 50 years and on seeing their x-rays have asked in surprise, why didn't my doctor investigate, discover and manage that? I thought that it was due to some arrangement within the medical profession, but when I looked at the medical guidelines for the management of whiplash, very few patients, according to that, are x-rayed, and so this aspect of the permanent harm of a motor vehicle accident remains unknown both to the GP and to the patient. So my advice to people is, if you've had a whiplash, get a chiropractor to have a look at you and see what it is that's wrong, and don't expect that you can clear it up overnight. In my experience, you've got to adjust the fixated vertebra over a period of time, and gradually it starts to improve. But it's not aimed at one or two visits and they're back to normal again. They're two entirely different forces. This is a view, or these are views, of side views of the neck. At the top you've got the jaw on the left, back of the head on the right, and the cervical curvature, which normally goes forward in a curve. It's spring-like and seems to provide the best of service if that's retained. These two shots are where the skull has gone back and forward and pulled the cervical curve backward, and on the right, what happens over decades with the spine that can't function well, the discs and the vertebra change in shape and deteriorate in function. Degenerative joint disease refers to the way that the inappropriately loaded spine starts to wear out earlier than it should, and it's decades before the person may get any symptoms from this. They dismiss what happened with the whiplash until they discover that it's been the cause of decades of misalignment and premature wear and tear. These are recognised symptoms of whiplash: neck pain and stiffness, loss of motion in the neck, headache, tenderness or pain in the shoulders, pain in the upper back or arms, tingling or numbness in the arms, dizziness, ringing in the ears, which is called tinnitus, sleep disturbances, irritability, tension and fatigue, difficulty concentrating, muddled thinking, memory problems and depression. So that's it for this news brief. There'll be more of them to follow. What happened in college when we understood that it gets out of place, loose movement, irritates the nerve and so on, with a whiplash, was that we just accepted the fact that this usually occurs. What I found was that this is not an idea that's accommodated by the medical guidelines for the management of whiplash. In most instances, those structural and mechanical misalignments still aren't found 50 years later, but there'll be more on that later on. Now, before I go, please, if you know someone who has had a whiplash or would be interested in this subject, please network this news brief to them. My view again, I believe that everyone from infancy to old age should have regular spinal checkups. And you've got to keep your eye in the rearview mirror and drive safely. All the best to you. Bye-bye.